Welcome to the Virtual Health Revolution, the podcast dedicated to inspiring health coaches and clinic owners just like you to explore the heights of your potential in the digital era. I'm your host, Karen, and together we'll uncover the secrets behind successful digital transformations in the healthcare industry. So whether you're deep in the trenches of clinic ownership, looking to scale your impact without being overwhelmed by more hours, or you're just starting out dreaming of the endless possibilities digital health offers, you're in the right place. Today, we're diving deep into the stories, strategies, and successes that define the virtual health landscape. Together, we'll explore how you can not just participate in, but lead the revolution that is reshaping the future of healthcare. All right, welcome back, everybody, to another episode of the podcast. I'm super excited for this one. I know I do say that a lot, but I really, really am, because I have with me Dr. Jason Shumard, founder of drshummard.com, and I'm going to say the leading type 2 diabetes doc in the United States right now, especially when it comes to virtual programs. So welcome to the podcast. Thank you for doing this with me.
Yeah, you're making me all blush right now and everything. I feel like they're speaking too highly of who I really am, but I appreciate that. Thank you.
Not at all, not at all. But I love that you say that. You've throughout this whole journey, it's been so cool to see how successful you've been able to become, but you stay super humble. So why don't we start? Can you tell me a little bit about this journey? Where did you start? Because you started in a traditional chiropractic clinic, Integrative Wellness Center of San Diego. How did you start there and then create drshummard.com, which is 100% virtual? You're helping people all around the country with their type 2 diabetes in high ticket programs. Take me back. Tell me how it started.
Yeah, so just as you said, we did have a brick and mortar for many years. I was in a brick and mortar practice I started in 2005, a traditional chiropractic office, then moved into functional medicine a few years after that, and then hired on associates, went full-time functional medicine. And when my wife and I started having kids, I've realized that, I wasn't spending a lot of time with them. I was getting home really late, leaving early in the morning. I just didn't think that was really fair. And selfishly, I knew I wanted to go into something more virtual, because I just felt like it was going to be easier. I wanted to be at home more often. I wanted to be around my kids and be able to do the things with sports or whatever else they wanted to do. And luckily enough, like a lot of other people got experience, and it was probably a bad thing that happened, but luckily for me, COVID happened. Yeah. And so all of my stuff that I was doing before was all live. I did live dinner presentations, going to a hotel or to a restaurant, and that type of marketing. And that all changed immediately. I remember when COVID hit, it was like on a Tuesday, I can't remember, Monday, Tuesday, when they shut everything down. I had an event on Friday that I'd already paid for, it was already done. We had marketing already going out for that, and I had to pivot. I didn't know what to do. I didn't know anything about social media or marketing, or online webinar type stuff. So I literally went to my office. I turned on a video, went Facebook Live. We sent a link to everybody. And I had 3 people show up to this thing, and one person bought a consultation. We went through the whole process with them, and they purchased the program. And I was like, that's interesting that we can do this. And that's when we started shifting everything into the virtual. And since then, I've been essentially working virtually from my home since, 2020?
Yeah, amazing. And so what does your practice look like today then? When you say virtually, what does your practice look like right now?
Yeah, it's definitely expanded in over the years that I didn't expect to occur, but again, call a little bit of luck, call a little bit of being in the right place at the right time. But when I previously to doing virtual, I was doing almost everything. I would do the events, I would do the consults, I would, do the sales process, if you will, reviewing testing, and also all the quote unquote treatments with the patients as well. And I just knew I couldn't scale in that model. So we've transitioned that model into more of a team environment now. So now we've got health coaches, we have a sales team, We have virtual assistants. We have what we refer to as patient care coordinators who handle all the patient day-to-day activities. So we've got more of a machine, if you will, of our practice, which has made things a lot easier for me. I have, again, more time to do things. Obviously, there's more training and there's more systems that need to be in place and everything. But as we continue to place these systems in place and we scale, it's making it more efficient for patients to get the care they need.
Yeah, I love that. And I think that was maybe one of the only good things that did come out of COVID was that actually patients or people are more open to getting virtual healthcare, right? Like they almost want it. Like I feel like there's this like expectation that you've at least got some sort of virtual offering these days. Like if somebody can get the same type of care or you know, get the same type of results without having to leave their home, why would they want to leave their home to go somewhere else?
100%. I mean, just in San Diego alone, there were some patients that were driving 45 minutes one way to my office and then 45 minutes back home. Yeah. So now you're saving someone an hour and a half where you can just meet with them virtually at their own home. They're comfortable, don't have to waste gas or whatever else as well. And we not only were patients happier, but we were still seeing the same benefits they were getting, the same results, and some of them were even better, in my opinion.
Yeah. Now, some people get really stuck about what a program, like a virtual program, looks like. Can you talk me through what is your, so you specialize in helping people with type 2 diabetes. What does your program look like?
So essentially, our program really entails, the starting point is we have a webinar that they watch because we want them to be really educated about what we do to make sure we're meeting with the right individuals, right? And so when they come in, they meet with myself or one of our team, they already have an education of what we do. They already know what we do. And now it's just about getting the information we need and then moving into our system. So our process is we do advanced comprehensive testing to identify the underlying problems that are contributing to their inability to regulate blood sugars, i.e. their diabetes. And then we then customize a program to their needs to address their problems. Now, our programs are quite unique, I would say, because not many people do this. Traditionally, in the functional medicine avenue, you put somebody, you give them recommendations, they go and do it for a little while, they come back, you reevaluate, and that kind of goes back and forth. Well, what we have found is that the compliance is really low when you do something like that. So when we put together a program, we do a whole program, whatever that might be, 6 months, 9 months, 12 months, whatever they need, and they know upfront what they're going to be doing, how often they're going to be seen, what the costs are going to be, everything. So we establish everything and they're committing to the entire program, which has given us a compliance that is way higher. And we have a 90% plus that are actually going to complete the whole program as well.
Yes, 100%. I love that. Rather than having people pay per session, right? Like if we package it up into and do you mind sharing like what, because then you can also, it's better for the client, more compliance, as you said, they've actually invested up front, they know what they're up for, they are committed. Also better for the premium for that and know that that income is coming through, because what do you charge for your program at the moment?
Yeah, our program is roughly around $15K per patient. Some of them may be a little higher, some of them may be a little lower, but roughly around that 15K is where our programs are. And they know upfront what the costs are going to be. And then we just figure out a plan for them. Some of them may want to have a savings and pay for it all up front and get a savings. And some of them want to break it up into payments. But whatever's more comfortable for them and within their budget, we're going to work with them to figure out the best option for them.
Yeah. And what do you say? Like I often get docs telling me that people aren't going to pay $15,000 for a health program.
Yeah, I would say, I mean, I used to be the same way. I used to think the same thing and say, who's going to pay that? Yeah. And typically it's usually something that's within you, thinking that your program or your services are not worth that. And when you finally step out of that place and know that is worth it, because think about this. When you go, if a person with diabetes, for example, who has to get a leg amputation, well, leg amputation is going to cost the hospital going to charge probably around $150,000 for them to remove their leg, and they still have the disease. So you're taking someone and helping their body get better. They're getting off medications, in many cases reversing or not even showing a non-diabetic situation, essentially saving their life from going down that route. And they only have to pay $15,000. That's a small chunk of change of what the rest of their life is going to be like with their family and loved ones. So in my opinion, and I tell us, I'm being dead honest when I say this, I think we're charging too low. Like we should be charging a lot more because I feel like our services are worth more, but we also have to make sure that we're able to be in a place that people can financially afford it. Because we have a mission in my office, and my mission is to change the lives of 1 million people. And I know I can't do this on my own, but I know if I overcharge, yeah, there's gonna be people who will pay for it, but there'll be people who really need this who can't do it. And I want to make sure those people have an opportunity as well.
Yeah. Though, there's people say that at like the $1,000 price point.
Yeah.
Like they say like, hey, I want to make sure that I give access to more people. And so I only want to charge $1,000.
Sure.
Yeah. But no, I get what you're saying. And I mean, that's you're able to charge at a price point that I think, as you're saying, a lot of docs get in their head about charging a higher ticket price, right?
Yeah.
And it's just about focusing on them rather than focusing on you. I think that people, when they're unable to, grasp charging something like that, it's usually, change the focus. Think about the client, which is what you're thinking about. You want to help save their life.
That's exactly right. And the more that we recognize that we are making a significant difference in these people's lives, not just helping them eat better, taking some supplements, whatever they're doing, like this is actually literally changing their lives for the better so that they have the opportunity to be around here for their friends, family, and do things they need to do. That when you take that into consideration, it's actually priceless. And so I think that we could all be charging a lot more for our services because we're worth it.
100%. And especially compared to what they're going to get if they leave your office, right? They're going to get the traditional medical model. They're going to get, perhaps their leg amputated. They're going to get a whole bunch of drugs. What are their other options? You either communicate enough value to them that they sign up for your program, or they end up out there in the woods for sure. So you said, and obviously we run your marketing, so I know, but we use a webinar to get people to the first, I guess, we use cold, we advertise to cold people using, Facebook and Instagram ads to our webinar. Now your webinar converts really well. Have you got any tips when people try to start this in terms of doing a good webinar? What makes a good webinar? Why do you think yours converts so well?
I think there's 2 reasons why. The first one, I'll tell you, I did my webinar twice a week for an entire year.
That is so true. You did live, guys,
live.
Twice a week.
I did it twice a week for an entire year until it started to convert to a certain level. I think we decided around 12% live, I think is where it was. I think it was right around that. I can't remember exactly what it was. So yeah, I did it live for an entire year, twice a week, until I felt really comfortable, until I felt, but the other thing I would also do on those live is that when you do a live webinar, you can actually see on the top how many people were actually on your webinar. Yeah. And my goal was to make sure that we had a certain percentage staying on from the beginning to the end. Because I knew at that point, what I was saying was enticing enough that it was captivating, that they wanted to stay on and listen to the entire presentation. So once I saw that with our conversion, that's when I decided, okay, let's record this now. We're ready to go. And that's when we've been doing that recorded version ever since.
Yes. And I must admit that's something I love about you is that you always want to get better. Like I think that in the docs that I see that do really well, they always want to like get feedback. How can I do better? I can remember you saying once, you convert really well in your sales calls. And I can remember you've been doing them for years and you still got people to review them. You telling me you still got someone to review them to see how you could maybe do better.
Yep. 100%. Like I still do that to this day. So like, because I feel like if you're not learning, then you're dying. Right. And so for me, I constantly want to improve because I know I want to be the person that our team looks up to and who's trying to beat me every single month. Now, rarely does my team beat me, but that's okay. I bet eventually I want them to beat me. That's going to not only help them because it's going to help them, earn more income, but also help the amount of people that we're able to help as well to get the care they need. So that competition is always good. But for me, I just feel like I want to make sure that I'm fresh. I'm also learning and expanding because there's always new things that can be brought to this scenario to get better, in my opinion.
Yeah. And when you say your team beat you, so this is your sales team, right? So what does your sales team look like now? Because you've expanded past, so, in the beginning you were doing the initial consultations, selling into lab packages, doing the report of findings, selling into your, your program, your high ticket diabetes program. But now you've got a sales team helping you out do some of these calls, right? What does that look like now?
Yeah, so we have, including myself, 5 sales team on the sales team, and we're looking to bring on 2 additional ones, potentially 3 before the end of the year. So we should be somewhere around that 7 to 8 people on the sales team. Now, not all of them work as much as I do. Some of them maybe work less hours, but these are people who have the same mission. These are the same people who are excited about helping individuals and maybe just don't want to run their own practice or want to have all that minutia, but that still want to be involved in people's lives and getting them better. And it's been a really cool experience.
Yeah, and do they do all the calls? Like, do they do the initial consultations, the reported findings? How do you structure your sales team in terms of what calls do they take?
Yeah, so the same thing that I do. So again, from the webinar, they meet, we do an initial consultation. We call it our diabetes strategy session. It's a 30-minute 30-minute consultation. And from that consultation, we move them into the opportunity to run testing. So then they run the testing, then they meet with them roughly about 3 to 4 weeks later, once we get the results back into the ROF. And then they convert the person. They go over the financials, they convert them into a program, put the program together for them, and then we move them on into our back-end team, our patient care coordinators, as we call them, to finalize, just to stabilize what they're going to be doing for payments, et cetera. So they do the whole process all the way through. I don't do any of that from their perspective. They review the testing. They get the patient set up on testing, that the whole process is done without me having to do anything. I don't touch that at all.
Which means that although you're currently doing sales calls yourself, right, or that process yourself, when you step away, this machine keeps working.
That's exactly right. And that's the goal. That's my goal, is to, not that I don't love doing this, but again, I want to be the face of the company, right? So the marketing aspect of it, because I know if I'm able to focus on that and not have to be in the day-to-day activities, it's going to be ability for us to scale and grow to be able to help more people. We're not going to be able to meet our goals or our mission of changing the lives of 1 million people where we're currently at. We have to continue to scale to get to that level, to make sure that there are people, all over the country, potentially all over the world, that know what we're doing and that there's opportunities for them to reverse their diabetes.
Yeah, I love that. And so I talk to a number of docs who want to create what you've created, because they're maybe just starting out. They're in their brick and mortar. They're back where you were in 2020, but they want to add a virtual component. But they get really stuck. What do you think has helped you, like, really keep taking the next steps to get to where you had enough revenue coming through to get the sales team? Are there any things that you see, and maybe you talk to other docs or within yourself, that helped you get to each next level?
I think the biggest thing that's helped me is having the right people around me, right? Having individuals like yourself who can really handle that like marketing. Like, for instance, we haven't talked about this, but when I first met with you, I was like, I don't want to do anything with the marketing. Like, I want you to handle everything: social media posts, blogs, everything that is done, all the back end nurture campaigns, all the social media stuff, like that is all done. I just want to meet with you on some regularity, have a conversation, see how things are going, maybe make some tweaks. You tell me if I need to shoot some videos, some content videos, or whatever it is, and you handle all that. that is a huge chunk that I can take off my plate. And then making sure we hire right team members as well, right? So I have like our office manager. She's just incredible. She handles all the team. She does all the training. She does all the financial stuff. Like, and when you have the people around you that are able to take things off your plate and allow you to do other things, that's how you're going to be able to keep the ball rolling. But if you're one of those individuals that wants to do it all yourself, it's going to be very challenging. I'm not saying it's not doable. It's going to be very challenging because when you have the right people in place, that's how you're going to continue to grow and not burn yourself out.
Yes, I love that. And also be open to investing in making sure that you've got these people in place then. Because I talk to docs who keep it, sometimes are scared to invest in these different people. And that's almost why they want to do it all themselves because, they don't want to, it's almost hard to outlay it in the beginning when you're getting started. Did you have some of those thoughts, or you've got the mission, you knew where you were going, or talk us through some of that?
No, it's true. I mean, think about it. When I was in that scenario with COVID, for example, I mean, I didn't know if we were going to have to close down our business, if I was going to have to start to find another career because, I'm in California, everything's shut down. And I know that happened in other states as well. So nobody was coming into the office. We were trying to do things by phone to keep the things rolling. And, we started just meeting some people through Zoom appointments and making sure that I can stay from home so we can continue at least fulfilling the individuals that we already had in our programs, right? And we didn't lose them and have to do a bunch of, refunds, if you will.
Yeah.
But what I didn't have is I had no new patients coming in, right? It means we had no new income coming in, which was something we had to really pivot right away. And so, at first I had to figure these things out for myself, right? I had to find out how to run a Zoom webinar. I had to, learn these things, but then I had to start investing into my company, right? And investing meaning bringing people like yourself on. And I know it was going to cost me some money, but I knew that there was going to be a return on investment. And after that, and I wasn't spending a lot of money. We were doing minimal marketing. It wasn't like we were spending, $100,000 a month in marketing. It was just small amounts to get the ball rolling. And as we got the ball rolling, we go a little further. Okay, now we start having more patients coming in. We had the opportunities coming in. And as we started to increase that ROI, I was putting all that money back into the machine. I was really only taking the amount I needed to survive and take care of my family. I wasn't taking a lot of profits. Everything was staying into the company. And so we were able to continue doing that. And so that's how I was able to do this. Not everyone has maybe the same type of ability to do that because maybe they need more money or whatever else it is. But what I would say is the more you put back into the company and the more you invest into your company right now, the dividends are going to pay off exponentially down the road because our profit margins are way higher now than where they were 3 years ago.
Yeah. Oh, yeah. And also, I think, working with you as closely as we do, you also have been able to do this consistently. Like when it comes to investment, or you spend a decent amount on Facebook ads now, and sometimes there are worse months than other months, right? But you keep going. Yeah. I think also, somebody asked me the other day, what do I see? What are there docs that work with you that don't continue working with you, and what happens? And what I said was, it's like if someone doesn't make money right away, or they have a bad month, sometimes they go back to their brick and mortar and they don't consistently have that goal and keep moving towards it, because you're going to have a little bit better months or worse months, and you've got to be able to, you consistently know where you're going, and you just keep going. Yeah.
And I don't know, not everyone is a big fan of this individual, but I'll quote Tony Robbins, right? When Tony Robbins says, when you want to take over an island, you go to the island and you burn the boats. Meaning you commit. There's no going back, right? And that was me. I was not going to go back to my brick and mortar. There was not even a chance of that happening. So I committed. It's either this is going to work or it's not going to work, right? And so when you have that kind of mindset, there is no alternative. This is what has to happen, and we have to work and work and work. And this is one of the reasons why I've been, again, very lucky, very fortunate, having the right people around me that were supporting me, helping me, my family and other colleagues in this process to make sure that we were able to achieve the ability to get to where we are. And I'm very blessed, very happy of having these individuals like yourself around me who's been able to help me to expand into the level that we're in, because I can't do this on my own. And I will not tell you, I did not do this on my own. We had the right people around us.
Yeah. And you say, you need this team around you. Any tips for building this team? How do you find the right people, or do you have any tips for someone who's struggling to get started?
Yeah, it's a tough one, because that was hard for me as well, right? Because I didn't know who and where to go. Again, I got lucky because I was in a mentorship where I met a lot of great people that were way more intelligent, and they did things a lot better than me, and I just kind of continued to hang around them. So, first and foremost, maybe you want to find a mentorship if it's functional medicine, or and one more thing I'd recommend as well, this is kind of off the subject, but I know a lot of individuals who do functional medicine, and they're really good at functional medicine or nutritional support or whatever you want to term that term there. But unfortunately, many of them are what we refer to as a jack of all trades. They're trying to do everything, and it's very difficult. This was very difficult for me in my early years. I remember when I don't want to just say it but I was just doing chiropractic, if you will, and I was going to these referral type groups locally. And I remember I was very young. I was like probably 28, 29 years old, and thinking I could help everybody. And I was like, anybody with a spine I can help with. And these guys were trying to put in my brain, like, you have to niche down. Like, what are you specifically going to be doing? Because it's easier for people to find you when they know what you're doing. So, and it took a lot of years, because my head is a little hard, I bet, apparently. But once I figured out, like, hey, if I can niche down to a situation, a condition that I know I can help with, then we can focus on that. And the amount of people you're going to be able to help will be way more than if you're trying to do everything, because nobody knows what you do. Not many people know about functional medicine, but when you start talking about reversing diabetes, they get that.
Yeah.
They can find you. So if finding mentors, finding individuals who are in the space, who understand, that's much more prevalent these days because of COVID and people doing a lot of virtual type things, getting around them so they can teach you how to do some of this stuff. That's what I'd recommend for individuals who are seeking out that type of help. Trying to do it on your own, you could do it, but again, who wants to recreate the wheel when someone's already done it?
Oh, no, 100%. And it makes it way easier for your marketer to get people to you if you've got a niche.
Yes.
Especially, if you have a brick and mortar clinic, it's a little bit easier. It's still important, but a little bit easier to be a jack of all trades and have people walk in. But online, you really need to be specific. There's so much noise. You need to be able to describe the condition for the person that you want to work with better than they can describe it. Like, you really want to think about, when they come into your clinic, how did they describe it? What are they coming in and saying to you? And that's what you want to be kind of putting back out there, because it gets noisy, and you need to be specific. Somebody needs to know, is this the right fit or not the right fit? As soon as there's uncertainty, they don't take action. So we need to be, when we're doing marketing for Dr. Shumard, we're making sure, hey, do you have type 2 diabetes? This is the place to be. So yeah, 100%. Yep. I mean, I can't say that enough. Especially, it's just cheaper and easier. If you want to have more general functional medicine, I mean, you could market it. It's just going to cost you more to get people through the door. It's much cheaper and easier if you can really niche down and be the expert in an area. 100%.
Yeah, because when you get that person in your door, then you can educate them on what you're doing, and then they can send you referrals for other things if you want to. Maybe it's their spouse or their sister or their brother, coworker, and you can get referrals that way. But from a cold type traffic, which we were talking about here today, which is most of the stuff is cold traffic, they need to be more, it has to be more specific and have an idea of what you do prior to them meeting with you, so you can really have that conversation with them.
Yeah, no, 100%. Yes. Yes, the people that want to do everything, it's a lot harder to market to them. So yes, if you can choose a niche, stick to doing that, no matter, even if you can help lots of people, it definitely helps. Awesome. Anything else you want to leave our listeners with that has been transformational for you? Any mindset shifts you had to switch for really selling at that higher price point besides really focusing on them?
I think the two biggest shifts for me were recognizing that I can't do this on my own.
Yeah.
Because there's a couple things, at least this was my thinking, and this is maybe not everyone's thinking, but my thinking was, okay, if I bring on additional people, it's going to cut my profits, which means I have to work harder and do more things and to get those profits back up. But the reality is that when you bring on individuals that are going to help you as part of your team, your profits go up, which means you have more time, energy, and the ability to market to more, hire on more people, and live the quality of life that you want your family and you to live. The second one is not thinking that, even though like I'm the face of the company, right? Dr. Shumard is the face of the company, that people are going to be upset if they don't see me, right?
Yeah.
And that's not actually true.
Yeah,
so,
yeah.
And it was a big thing. Like my team was thinking it, that people were like, well, they're going to be angry they don't see you. And we don't really, every once in a while you may hear someone say, well, I thought I was going to see Dr. Shumard, but it's usually not the case because these people just want help, right? It's okay. And if you have the right communication cycle, when the person comes on, it's like, hey, I work with Dr. Shumard, and then we go into our process of our consultation type of thing. They just feel comfortable. They're fine. They're not, they're not upset that they're not meeting with me, and the results are the same. There's people that I'll meet with, because I usually like to meet with them at least once throughout their program, and it's kind of like, oh, I'm so glad we finally got to meet. Like it's like it creates that authority where they really trust what you say and what you do when they don't meet you. Yeah. It's like it's more authoritative, and they more are like entrusting you when you do that. So when you give them a recommendation, they're going to follow that to a T. Where now, in some cases where I know a lot of newer docs, or maybe some docs are just learning this, especially that negative connotation sales, they're very reachy. And just think about this, like when if you're dating, right? You're out and trying to date people, and if you're overzealous, or it's like too much, it's like it's a big turnoff. Well, it's the same in the sales process, if you will. So it's not like you're trying to be hard to get, but it's the communication is that where you're communicating and asking them questions, so then they come up with the conclusion that they need this and they want this. Just like if those slick guys or girls who get all the dates and everything, it's not that there's anything special. They just have communication styles that really work, and it gets that same type of response. So it's no different here.
Yes. And also when you have somebody on that sales call who then is almost selling themselves into it, like wants it, they're also better, they're more likely to continue with the program too and get better results, right? And have less buyer's remorse, have less refunds. If you can, during that call, they're almost going to sell themselves into it. If you've got to push them, then you've got more refunds, more buyer's remorse, those types of things, less compliance. That's
100% accurate. And I'm not saying we don't get some people that are like that. They're like, I'm not interested anymore, or they don't stop. They stop sometime in the middle of the program. We do get that, but I will tell you it's rare. We don't really see it that often these days.
Yeah, awesome. Last question, what about financing? Are you seeing, do you have any tips to help get better better compliance with, or better approval rates with financing? Do you have any problems with financing? Do you use lots of financing companies?
Yeah, I think if you have a lot of different options, it's better, because we are seeing that the financing situation is becoming a little more tight.
Yeah.
With the rates the way they are, the more the requirements, let's be honest, we're in somewhat of a recession right now, and these things are going to happen. They're all cycles that'll happen, and that cycle will go back up again, and we'll see some changes. But the thing is, like when you have multiple options, now you don't want to overwhelm options to the patient. Like when you're explaining the options, I tend to only give two. Like you could prepay or you could do monthly. And if they do monthly, they're going to use one of our outside financing programs that are traditionally people are really aware of. But then we can be more structured with their budget. Like if someone's comfortable paying a higher budget, then we can use a specific program for that. So everything is really, when I talk about finances, it's very transparent. There is nothing hidden or secretive about it. It's very transparent. There's always specifics we want to nail down. I never give more than 2 options because more than 2 options is very confusing. And when someone's confused, they retract.
Yeah.
And they're going to use the old word, I need to think about it. Yeah. So, but if you're very structured and like you're saying, okay, well, here's your 2 options, which one works better for you? Okay. Here's your 2 options, which work better for you. Okay. This is your option. Fantastic. And you solidify it and now it's done. It's very simple, very easy process. Where unfortunately, a lot of people have a money script issue, right? They are uncomfortable talking about money. They're uncomfortable saying money.
Yes.
And so if you're thinking to yourself right now, like if you had to tell a patient it's going to cost $15,000, like immediately you can tell in my voice that I don't feel comfortable saying it. So then immediately you're thinking, okay, my spidey sense is up, something's off here. Rather, if your conversation is, listen, the total cost of your program is $15,000, you have 2 options. Here's option number 1, here's option number 2, what works better for you? And it's just communication, confidence, like looking them in the eye. Like there's no difference because I truly believe I'm not charging enough. I truly believe that. I should be charging more, but at the same time, I also don't want to overprice it to where people can't have the ability to do it.
Yeah, but it's so funny. People feel you even on Zoom, right? People feel you. Like,
oh yeah.
If you've got, keep practicing it until you believe it. Or even I find like on a webinar sometimes just coming to the end, even if it's like a $97 consult, docs will start going faster, even at that price point. So practice talking about money, slowing it down, making it matter of fact, as if they were going into a doctor's office. Yep. It's the same virtual. We get in our heads about it virtual, or I see docs getting their head about it virtual. But yes, if you feel funny about the money, somebody else will feel that you feel funny about the money, and then yes, they feel like maybe it's off. Maybe this isn't the way I want to go. So,
yep, agreed. And people, like you said, people can feel that, and it's like, why is it okay for a hospital to charge $50,000 and it's not okay for you to charge $15,000?
They don't blink when they say it. They don't blink. This is the bill.
Wow. This is the bills. This is what you have to pay. And it's like, okay. And everyone's like, it's not that big of a deal. But if you have someone who's doing a more natural, holistic protocol and they're charging this amount of money, it's like, oh my gosh, no, I don't get that response from people because of the way because of our strategies, because of the way we present, because of the way that we let the patient know that they're going to get results.
Yeah.
If you follow the recommendations. I always use this little like kind of line to kind of calm things down before I go over the money thing. And I always talk about when I finish with my program, I always say it's like following a recipe. If you follow the recipe, you're gonna get the result, and the food's gonna taste good. Everyone's gonna be happy. But if you change my recipe, you're not gonna get the results you're looking for. And exactly that, they laugh, and it kind of calms some things down. So by doing that, you're calming them down. And if you go into the money, they're easier to accept it and understand it, right? So it's a strategy to like get them ready for the understanding what they're going to pay. And they always say, they laugh like you did, and they kind of, I get it, okay. And so then they go into the money. It's like, then we have to make a decision what's going to be best for their budget.
Yeah, I love that. I love that so much. Well, thank you so much for chatting to me today. I have loved being part of your journey so far, and I can't wait to see where we take it together, 2024 and beyond. Let's help those million people, right?
Absolutely. Thank you for everything you've done for me as well. I appreciate it.
Yeah, of course. Well, thanks so much, guys. We'll leave it there, and we'll see you next time.